What is your biggest fear when walking into a hospital today? Is it not waking up from the anesthesia? Or maybe waking up groggy and saying something embarrassing? Well, count yourself lucky, because if you were alive just 180 years ago, your fear wouldn't be not waking up. Your fear would be feeling everything, every single second of it. Welcome to 1842, the dark era just before the discovery of painless medicine. The man standing before you in a blood-soaked apron is not a butcher. He is a respected surgeon. And the person lying on that table, unfortunately, is you. So when that cold knife touches your skin without any numbing, what really happens to the human body? Let's experience these 6 stages of agony together. Preparation, or rather the lack of it. The surgeon hands you a bottle of whiskey or perhaps some opium. He says, drink up. All of it. Your mind gets foggy, yes, you feel dizzy. But make no mistake, alcohol is not a painkiller. It just makes you drunk. Your nerve endings are still wide open. You are ready to feel the cold steel. In history, some doctors even tried hitting patients on the head with a wooden mallet to knock them out. But most of the time, you were simply told to pray. Do you see those burly, muscular men walking in? They aren't nurses. They are called Beadles. Their job isn't to help you. Their job is to pin you down and stop you from running away when the screaming starts. Leather straps tighten around your wrists. A heavy weight presses on your chest. There is no turning back now. You are on the table, and there is nowhere to run. Here, time is life. Your surgeon might be someone like Robert Liston. They called him the fastest knife in the West End. Why? Because he could amputate a leg in just 2.5 minutes. Speed was the only mercy back then. The faster the cut, the shorter the torture. But that first moment, when raw flesh meets cold steel. In 1811, the famous writer Fanny Burney underwent a mastectomy without anesthesia. She described the moment like this: I began a scream that lasted unintermittingly during the whole time of the incision, and I felt the knife rattling against the breastbone. The soft tissue is gone. Now it's time for the bone. The surgeon picks up his saw. The sound you hear next, that grinding, rasping sound, will haunt your nightmares forever. But it's not over yet. They need to stop the bleeding. Stitching is too slow. So what do? Cauterization. They press boiling oil or a red-hot iron directly onto your open wound. Just when you thought the cutting pain was over, now you meet the burning pain. Survival, or the lack thereof. The surgery is over. You didn't pass out. You endured it. Congratulations. But do you remember that bloody apron the surgeon was wearing? It hasn't been washed in months. It is covered in the blood, pus, and germs of every patient before you. Back then, they didn't know about germs. Surgeons didn't even wash their hands. So even if you survived the table, a silent killer known as hospital gangrene could still kill you in your bed. Your chances were literally a coin toss, 50-50. Thankfully, this nightmare ended in 1846, when a dentist discovered the magic of ether. So the next time you see an anesthesiologist in a white coat, remember to thank them, because they don't just put you to sleep, they protect you from history's most brutal torture. Now be honest with me, if you lived in the 1800s and needed an amputation, what would you do? Would you get on that table and choose the pain? Or would you risk the infection and wait for death? Let me know in the comments if you have the stomach for it. See you in the next strange story. Stay safe.